Now I'm at the portal vein. Sometimes I'm going to come up a little bit more superior, again, just to give myself more room to angle. Go ahead and take a breath. So, and like breathe for a minute. So I'm looking at the portal vein, I've elongated it, I'm going to come up superior again. Now that I'm in the orientation with my probe, I'm obliqued to be with the portal vein. I'm going to angle slowly, downward and slightly to the right. And the common bile duct is going to come into view. Is it going to come into view 100% perfectly on its own? No, I'm going to have to still elongate that structure itself. Freeze. Because everything is in a general relationship vicinity, but that doesn't mean that it's all totally lined up. So I started totally transverse.
I'm squinting.
I came down. I obliqued a little bit for the portal vein. I angled with the portal vein. Then I come up superior, and I gave myself a little bit more room with my probe with tissue so that I can angle down without accidentally slipping right past the common bile duct. This is just something I've come up with over time. So once I see the common bile duct starting to come in, that doesn't mean I take my picture there. I now need to elongate the common bile duct. So we elongate the portal vein, angle, elongate the bile duct. So I'll show you that again. Big deep breath and hold. Coming down, angling through. Here's my portal vein coming in. Elongate it. Come up. Start to angle out. You're going to see some structures, and you're going to elongate, and you're going to use color to confirm, and you're not going to use your color on the wrong scale. You're going to adjust your scale appropriately so that you can be confident that you're looking at your bile duct. Breathe.
What's a good color gain? Like,
so you'll kind of learn over time what works, but generally speaking, the color gain in the portal vein region is going to be somewhere in the 20s. So around that region. So what I do is I kind of head down and then work my way up. With the color, you can always adjust the color to fit even if you didn't know what the number was. So when I'm looking at color, take deep breath and hold. Let's say I'm just going to look at the aorta. I'm going to put my color on. Does she have no blood flow in her aorta? Doubt it. So I'm going to look at my gain. Oh, my gain was 0. No wonder I couldn't see anything. So I'm going to turn my gain up. I'm going to invert my scale so I can get back to the right color. Now let's say I'm down here at 34. Okay, breathe. Do you see how the color's aliasing? I have this mosaic pattern. My scale is too low. When you have aliasing, your scale is too low. That's a fact of ultrasound. You know that fact? Cool, now you can use it to be smarter. So first we're aliasing, we're at 34. My gain is 13. Who cares about my gain right now? I'm getting my scale right. So I'm looking at this. I'm going to start increasing my scale. One click at a time is all it takes until you get to the point where you're no longer aliasing. Now you just have your flashing. You can even continue past the point where it's really flashing, and you can kind of get a uniform velocity. Okay, cool. Breathe. Now it's better. Now I have this scale is appropriate, but my color gain isn't really 100% perfect, so let's work on that. Big deep breath and hold. So I just want to adjust my color gain. Okay, let's start with going up. So you're going to need to make sure that your color gain is correct, right? So you can turn it up all the way into the point where you get speckling. Breathe. If you're trying to make sure that you have adequate color fill. In this case, I knew it was overgained, but let's pretend I didn't know that. Maybe I'm looking at something a little bit more slow flow. I'm going to overgain to the point where I get color speckling. Now I'm bringing up color that isn't even real. This is just filling up the box with unnecessary color. So now I'm going to turn my color gain down. And I'm going to keep turning it down. There it goes. Until it fits with the vessel walls. And that's it. So now it fits because we don't want to overbleed. Okay? So that's the general concept behind color. So when you're doing anything, you can use that little method. Turn my scale down until I alias. Turn my scale up until I don't alias. Turn my color gain up until it speckles. Turn my color gain down until it no longer speckles and it's just fitting inside the borders. And that's going to come in handy when you have something that's causing a lack of flow or an obstruction of flow. Like let's say you have a blood clot, but it's not completely blocking the vessel. You need to make sure that your color shows appropriately how is that blood flowing over the vessel, because you can set it up that it looks just like the vessel's totally patent, it's full of blood flow, but it's not really. Your color isn't accurate. So the only way to know it's accurate is to use a little methodical approach. So there's that methodical thing again. Looks like it's going to be here to stay. Okay, and as far as the common bile duct goes, hers is just